Colon cancer is one of the leading causes of cancer-related deaths. But here's the truth. It's also one of the most preventable. The problem? Most people ignore the early warning signs. Hi, I am Dr. Prado, a general surgeon, and today I'll walk you through the real signs and symptoms of colon cancer, what they mean, and when you should actually take them seriously. By the end of this video, you'll understand not just the symptoms, but why they happened and what to do next. Colon cancer usually begins as a small benign growth called polyps. Over time, some of this can actually transform into cancerous lesions. The symptoms you experience depends on where the tumor is located, whether it's on the right side or the left side, and how advanced it is. That's why early detection through colonoscopy is key. But understanding the warning signs can help you catch it even sooner. So these are the early subtle signs that something may be wrong. Number 1, a change in bowel habit, like new onset constipation or diarrhea lasting more than a few weeks. The second one, narrowing or ribbons like stools, caused by the tumor partially blocking the colon. The third, blood in the stool. Sometimes it could be bright red, sometimes dark and tarry. The fourth one, unexplained fatigue, due to slow or chronic blood loss leading to anemia. Lastly, some vague symptoms such as abdominal discomfort or bloating that's persistent and worsening. These are the 5 things that you have to consider. Either it's going to be a mechanical issue or a bleeding issue are the early signs and symptoms. Remember, these symptoms can overlap with common GI issues, but what matters is the pattern and persistence. So when do these symptoms become concerning? You got to watch out for these red flags. And these are blood in stool combined with weight loss or fatigue. As the cancer continues to bleed because of ulceration in the mucosa from the tumor, the cancer also starts eating your nutrition up because as it grows, it takes more energy from you. And this leads to fatigue and weight loss. Next one, persistent abdominal pain or fullness. These are vague symptoms, but sometimes when there is irritation from the tumor burden, this starts to cause the symptoms, and finding it out earlier rather than later may make actually disease cure a possibility. Third one, a change in bowel habit lasting more than 2 weeks. As you could see, we actually placed a marker of 2 weeks, and that's something arbitrary because other disease factors can actually be more persistent, such as IBS. However, having a formal investigation to provide the proper diagnosis and rule out the possibility of cancer is something that you should consider if you are at risk. Lastly, unexplained iron deficiency anemia, especially men or postmenopausal women. Again, as bleeding actually does occur because of the GI tract from the tumor, this is something that sometimes is caught unaware by most patients and is noted on laboratory tests. And if it is, finding out the cause, ensuring that there are no tumors causing it, is something that we should consider. So, how do we find out? Going back and looking at our previous video talking about colonoscopies, screening is what saves lives. Colonoscopies can find and remove polyps before they turn cancerous. Other options include the FIT test or the stool DNA test, but colonoscopy remains the gold standard. If you have symptoms, screening shouldn't be delayed. You got to talk to your doctor or a gastroenterologist. The key to beating cancer is awareness and early action. Don't ignore your body. Pay attention to persistent changes, talk to your doctor, and stay on top of your screening. I'm Dr. Prado, and my goal is to simplify surgical and medical knowledge so you can make smarter, healthier decisions. If you found this video helpful, please click the like and subscribe button and check out my full playlist of colon cancer to learn about staging, treatment, and prevention. Again, if you guys have any questions, type it in the chat, and I'll see you guys next time.